Dear President and members of the Specialty Committee of Preventative Medicine of World Federation of Chinese Medicine Societies, dear guests and participants, I am honored to be here with you in this beautiful city of Nanchang. Now I present TCM Preventative Medicine in Portugal, TCM College of Lisbon Activities Report. From Portugal we have very good news. TCM has been legalized since 2013. The last missing decree, a specific law establishing the mandatory study plan for TCM doctors, has been published last February. Now both acupuncture and TCM are completely legalized and regulated in our country. The future professionals must attend 4 years full-time higher education courses and receive their working license from Central Administration of National Health System. All the other rules for this profession are similar to the other health professions. Quite a lucky situation in Europe, where up to now only the island of Malta and Switzerland have some basic regulations for professionals in this area. 2 years ago, I presented in the same conference an approach to TCM Preventative Medicine focused in the preventive support for TCM clinical patients. After consultation process, patients must be advised about lifestyle, diet, medical qigong, auto-massage, constitutional herbal medicine, etc. This kind of prevention aims to prevent new episodes of the disease that has been under treatment and improve recovery and quality of life. The case of the patient is well known and often constitutional weakness have shown up during clinical contact. In these cases, TCM has most significant possibilities if the patient accepts the necessary changes in his life. This time I would like to consider TCM Preventative Medicine for the population in general, for those that do not attend our clinics. In Portugal, as in many other countries, public preventative medicine mainly means campaigns for more physical movement and sports, better diet, vaccination, and early diagnosis for certain diseases. In spite of this representing a huge historical progress, we know TCM contribution can further public health prevention effectiveness in a very significant way. But we face 2 important difficulties. The first is that TCM is not well known in Western countries and our access to communication media is developing but still very limited. The second difficulty is a paradox. TCM global diffusion depends much on its capacity to individualize the treatment. But preventative TCM must be directed to people in general, which is the exact opposite of individualized treatment. These are the major challenges TCM College of Lisbon has been dealing with. And I would like now to present what we have been doing about the first of these problems, to spread TCM in society, with our very limited means and lack of any kind of support. In the 3rd and 4th year of our 5 years TCM course, students do volunteer social clinical work out of the school, according to their level of TCM capacity. The finality is to prepare them to meet the social reality and also to spread TCM. Up to now, our school has promoted 137 of these intervention projects. The content of the intervention covers Qigong 29, TCM Dietetics 7, Tuina 34, Tai Chi for Health 12, information about TCM 9, and all areas of TCM combined, 58. The duration of each of these interventions is about 7 months during the school year. Each project is prepared with the entity where it will take place and controlled by a responsible teacher in all aspects of its execution. At the end, 3 reports are presented and evaluated, one by the responsible teacher, other by the students, and another by the entity. The typology of these entities is the following: social service of public administration, schools, senior associations and colleges, social services of churches, firemen associations, children institutions, city district social institutions, institutions for young people with social difficulties, senior residences, sports club and happiness. We have much to improve, but the results are positive. Many health problems have been solved. Many people adopt TCM personal health practice and lifestyle. Information and confidence about TCM developed. Our students find out realities they will have to deal with in their professional future. In the beginning, these activities we had to look for places for these interventions. In the present, the initiative is more and more from entities that come to us and ask for this kind of social service. We are also preparing 3 large-scale research programs aiming to prove to the public and national official departments the efficacy of TCM. If the results are positive, as we expect, we have enough professionals prepared to a boom of public interest in TCM practices. In all these 3 cases, the exploratory research has already been done with enough research field exploration and encouraging preliminary results. The first will be a replication in Portugal of a famous study of TCM patients' general empowerment, already done in other countries with good scientific validation and impressive results. Under the coordination of our school, we are mainly counting on the help of Portuguese TCM professionals for collecting information from their patients. Thank you very much.